Hi and welcome viewers of Nursing Academy 101. In this video, we'll talk about multiple choice questions for nurses along with the answers and rationales part 2, which will help us prepare for the NCLEX-Prometric exam. But before we start, please don't forget to subscribe, like and share the channel to encourage us to continue and provide you with all new. Question number 1. Which of the following early signs indicates hypovolemic shock? A. Slow heart rate bradycardia. B. Increased urine output. C. High blood pressure hypertension. D. Pale cool skin. The answer is D. Pale cool skin. Pale cool skin is an early sign of hypovolemic shock. It occurs due to vasoconstrictions as a compensatory response to maintain blood pressure. Bradycardia, increased urine output, and hypertension are not early signs of hypovolemic shock. Question number 2. What is the priority nursing intervention for a client with a stage 4 pressure ulcer? A. Applying a transparent film dressing. B. Administering systemic antibiotics. C. Implementing a pressure relieving mattress. D. Cleaning the wound with hydrogen peroxide. The answer is C. Implementing a pressure relieving mattress. Implementing a pressure relieving mattress is a priority nursing intervention for a client with a stage 4 pressure ulcer. The primary goal is to relieve pressure on the affected area to promote healing and prevent further damage. Applying a transparent film dressing, administering systemic antibiotics, and cleaning the wound with hydrogen peroxide are important interventions but not the priority. Question number 3. What is the primary purpose of forced lip breathing in a client with chronic obstructive pulmonary disease (COPD)? A. Decreasing respiratory rate. B. Promoting bronchodilation. C. Improving oxygenation. D. Increase lung volume. The answer is B. Promoting bronchodilation. The primary purpose of pursed lip breathing in a client with COPD is to promote bronchodilations. These breathing techniques help prevent airway collapse, improving airflow, and ease breathing. While it may contribute to decreasing respiratory rate, improving oxygenation, and increasing lung volume, the primary focus is on promoting bronchodilation. Question number 4. Which nursing intervention is appropriate for a client with a fever? A. Administering an antipyretic medication. B. Applying cold compressor to the client's forehead. C. Providing warm blanket to the client. D. Encouraging the client to drink hot fluids. The answer is A. Administering an antipyretic medication. Administering an antipyretic medication, such as acetaminophen, is an appropriate nursing intervention for a client with a fever. Antipyretics help to reduce fever by lowering the body's temperature. Applying cold compresses, providing warm blankets, and encouraging hot fluids are not recommended as they can potentially worsen the client's condition or cause discomfort. Question number 5. Which of the following is a potential complication of immobility in hospitalized client? A. Increased muscle strength. B. Improved circulation. D. Pressure ulcer. C. D. Enhanced respiratory function. The answer is C. Pressure ulcer. Pressure ulcers are a potential complication of immobility in hospitalized clients. Prolonged pressure on specific area of the body, particularly bony prominence, can lead to tissue damage and the development of pressure ulcers. Immobility doesn't result in increased muscle strength, improved circulation, or enhanced respiratory function. Instead, it can lead to muscle weakness, decreased circulation, and reduced respiratory capacity. Question number 6. What should be the initial nursing action when managing a client experiencing an anaphylactic reaction? A. Administering antihistamine. B. Elevate the client's leg. C. Administer epinephrine. D. Provide oxygen therapy. The answer is C. Administer epinephrine. The priority nursing action when managing a client experiencing an anaphylactic reaction is to administer epinephrine. Epinephrine helps reverse the severe allergic response by constricting blood vessels and relaxing the airway smooth muscles. Antihistamines may be administered, but they are not the initial priority. Elevating the leg and providing oxygen therapy are important interventions, but they don't address the immediate life-threatening nature of an anaphylaxis. Question number 7. Which of the following manifestations is an expected finding in a client with hypokalemia? A. Hypertension. B. Increased bowel sound. C. Muscle weakness. D. Bradycardia. The answer is C. Muscle weakness. Muscle weakness is an expected finding in a client with hypokalemia. Potassium plays a crucial role in muscle contractions, and low levels can lead to muscle weakness and fatigue. Hypertension, increased bowel sounds, and bradycardia are not typically associated with hypokalemia. Question number 8. A client with type 1 diabetes is exhibiting symptoms of hypoglycemia. What is the appropriate nursing intervention? A. Administered a rapid-acting insulin injection. B. Offer a high-carbohydrate snack. C. Provide a glass of orange juice. D. Encourage physical activity. The answer is C. Provide a glass of orange juice. Providing a glass of orange juice is the appropriate nursing intervention for a client experiencing symptoms of hypoglycemia. The high sugar content in orange juice can rapidly raise blood glucose level. Administering insulin or encouraging physical activity may further lower blood sugar levels. Offering a high carbohydrate snack is an option, but orange juice is a more immediate source of glucose. Question number 9. Which assessment finding suggests a potential complication of peripheral intravenous therapy? A. Warmth and redness at the insertion site. B. Formation of a small hematoma. C. Throbbing sensation along the vein. D. Prolonged infusion time. The answer is A. Warmth and redness at the insertion site. Warmth and redness at the insertion site suggest a potential complication of peripheral IV therapy, such as phlebitis or infection. The formation of a small hematoma may occur due to minor bleeding during insertion, but is not necessarily a complication. Throbbing sensation along the vein may indicate infiltrations, and prolonged infusion time may indicate a slow flow rate or occlusion. Question number 10. When assessing a child who is preverbal and nonverbal for pain, which pain scale is most appropriate? A. Numerical rating scale, NRS. B. Visual analog scale, VS. C. Wong-Becker Faces Pain Rating Scale. D. FLAC Face Leg Activity Cry Consolability Scale. The answer is D. FLAC Face Leg Activity Cry Consolability Scale. The FLAC scale is the most appropriate pain scale for assessing a child who is preverbal and nonverbal. It evaluates facial expression, leg movement, activity level, cry, and consolability to determine the child's pain level. Question number 11. Which of the following manifestations is indicative of acute respiratory distress syndromes, ARDS? A. Elevated breath sounds. B. A hyperresonance on percussion. C. Bradycardia. D. Cyanosis. Cyanosis is the answer. D. Cyanosis is a characteristic manifestation of ARDS, indicating inadequate oxygenation. Increased breath sound may be present in conditions like pneumonia, while hyperresonance on percussion is associated with conditions like pneumothorax. Bradycardia is not typically associated with ARDS. Question number 12. A client with heart failure is prescribed a loop diuretic. Which laboratory results should the nurse closely monitor? A. Serum potassium levels. B. Hemoglobin levels. C. Platelet count. D. Serum calcium level. The answer is A. Serum potassium levels. Loop diuretics can cause potassium loss through increased urine output. Therefore, monitoring serum potassium levels is essential to prevent hypokalemia, which can lead to cardiac arrhythmias. Hemoglobin levels, platelet counts, and serum calcium levels are not directly affected by loop diuretics. Question number 13. Which of the following statements regarding the administrations of intravenous medication is correct? A. Always dilute IV medications with normal saline. B. Administer IV medications rapidly to ensure immediate effect. C. Use the smallest gauge needle possible for IV administration. D. Check the compatibility of medications before mixing them in one syringe. The answer is D. Check the compatibility of medications before mixing them in one syringe. It's crucial to check the compatibility of medications before mixing them in one syringe to prevent adverse reactions or interactions. Not all IV medications need to be diluted with normal saline. IV medications should be administered at an appropriate rate as specified by the medication's guidelines. Using the smallest gauge needles may not be appropriate for certain medications or solutions. Question number 14. During a neurological assessment, the nurse instructs a client to close their eyes and touch their nose with their index finger. The client demonstrates an inability to perform the task accurately. Which area of the nervous system is most likely affected? A. Cerebellum. B. Frontal lobe. C. Occipital lobe. D. Medulla oblongata. The answer is A. Cerebellum. The cerebellum is responsible for coordinating fine motor movement, such as precise limb movement and balance. The ability to accurately perform tasks requiring coordination suggests dysfunction of the cerebellum. The frontal lobe is involved in decision-making and problem-solving, while the occipital lobe is responsible for vision. The medulla oblongata controls vital functions such as respirations and heart rate. Question number 15. Which of the following nursing interventions is appropriate for a client with a fever? A. Applying cold compression to the client's forehead and neck. B. Administer antibiotic medication as prescribed. C. Cover the clients with thick blanket to promote warmth. D. Encouraging increased physical activity to induce sweating. The answer is B. Administer antibiotic medications as prescribed. Administering antibiotic medications is an appropriate nursing intervention for a client with a fever. Antibiotics help reduce fever and alleviate discomfort. Applying cold compressors can provide temporary relief but may cause shivering, which raises the body temperature. The client should be kept comfortable but not excessively warm. Encouraging increased physical activity is not advisable as it may lead to dehydration and further increase in body temperature.